It is the popular saying that an healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nancy Oshogbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you, all our viewers at home. You're welcome to another educative moment with me, Bola Olayode, on the program The Great Mind. This week our focus is on the advocacy visit of Fortune Health Insurance Agency Management Team to the State Parliament. Since it's the access to quality, effective, and affordable healthcare services is the right of every citizen and not a privilege, irrespective of one's status. In line with the global practice, Osun Health Insurance Scheme is primarily established to provide the residents in Osun State easy access to quality healthcare services without tax. Understanding on the purpose of the establishment of Osun Health Insurance Scheme has been the basis of the commitment of the leadership and members of staff of Osun Health Insurance Agency to the full realization of the objectives and aims of the existence of the scheme. With the unflinching support being given by Governor Ademola Jackson Nuruddin Adeleke's led administration to Osun Health Insurance Scheme at ensuring the expansion of the scope of the scheme according to the promise he made on the day he took up the mantle of leadership to steer the ship of Osun State. This, however, encouraged the management team of Osun Health Insurance Agency led by the Executive Secretary Dr. Rasaq Akintunde Akindele to pay advocacy visits to Osun Parliament. The visiting team was received by the Speaker Honorable Adewale Olumide Egbedun and his members.
We have come to show appreciation to the House. We have received tremendous support and assistance, both officially and unofficially, from the Right Honorable Speaker and other members of the House of Assembly. We have come to show our appreciation that even though we have not come to introduce ourselves officially, we have been receiving massive support from the House. So we are very grateful for this. We have also come to discuss some nitty-gritty about the scheme that we run in the agency. The scheme has been operating very well. When I came into office, the statistic I have is that we have about 238,000 enrollees in the scheme. And out of this, only 4,000 were in the formal sector. What this means is that about 244,000 were civil servants and the foundation. And compulsorily, these ones are supposed to be part of the scheme. So what it means is that over the years, what we have been appropriating actually been money only coming from the government. And from the latest statistics that we have about the census, Osun State has about 5.5 million inhabitants. So if you have just 250,000 people in the scheme, what it shows is that more than 5 million people are still paying out of pocket for their medical bills. And that is not so good enough. If you look at the great countries that we have, what they dwell on for their health is insurance. And government really supports heavily the insurance policy. The people also contribute, and that's why it's a contributory insurance. And that's what takes care of their health. And that is why we see that quite a lot of them have longevity that we don't have here. Common ailments are things that really cause problems here when people don't have money to pay for treatment. And that's why we, when I came on board, one of the policies is that if we have 5 million people in Osun State, living in Osun State, we should not have less than 3 million people in that scheme. Because that is important, and that will ensure that their health is guaranteed anytime they are sick.
Having explained the mission of the management team of the Osun Health Insurance Agency to the Speaker and his members, The Executive Secretary, Dr. Rasak Akintunde Akindele, revealed the efforts so far being made by the leadership of Fortune Health Insurance Agency to expand the scope of Fortune Health Insurance Scheme.
My intention that I discussed with the management is that we have to increase the scope of this agency. Also the tariff. The tariff is something not to write home about. And when I compare it with other states, I found out that the tariff is still give to providers really on the low side. For instance, until recently that we changed the tariff, cesarean section, if any hospital does cesarean section and send bill to OIS, the money that is paid is 30,000 naira. Of course, everybody will know that that is far below what is operational anyway. If you want to do a cesarean section in a good hospital, the minimum anybody will pay is about 250,000 naira now. So if we are saying somebody should do cesarean section and come and collect 30,000, of course the response is that people will run away from providing such services. And that's what we have been seeing. In fact, when I came in, I saw about 7 letters of hospitals writing to us that they are not interested in continuing with OAs. That's not good enough. So what we did was, we first had a thorough analysis of our operations, and we had to increase the tariff. Now the tariff for cesarean section is not less than 80,000 naira. That's still small, but at least that's a major improvement on what it used to be. And also we have expanded our scope to include some other areas that people can benefit from. And if we do this, and the income is the same, it means that at the point we're going to run into some financial problems. That's why we have to drive hard to get the informal sector. We have used so many machineries. We have had employed consultants to help us do the campaign. We have also increased our media campaign about our activities. We have been doing door to door. We've gone to market, we've gone to people, and we are seeing the results. As at now, we have about 13,000 informal sector from 4,000 that I need. So in 6 months, we have gathered about 9,000 informal sector. But of course, that is still far from our target. If we say we want 2 million people. So we have also decided that, okay, let us find other means of doing, of increasing our capital base. We had a party with the labor, and I want to sincerely stand and thank the Honorable Speaker that he was invited at a very short notice, and he granted us the audience. We had a party with the labor where we told them that there might be need for us to increase the premium that we get from them. We get 1.5% of basic. If we compare that with any state that is doing insurance policy, it is the lowest. Osun Zone is the lowest. So we had a party with them, and they said, okay, they are going to look at how we can increase the percentage, whether we should wait for the minimum wage to come in, because, and I quite agree with the leadership, because it's difficult now to go and meet anybody and say, we want to increase the deduction when there is no income coming in. So we are anxiously waiting for the minimum wage to come into being. We've also tried to lobby the local government chairman to see what they can do. And what we are presenting to the local government chairman is what we have come to humbly present to the House, that if it is possible, we could make it maybe a rule or a law or whatever that, okay, all honorable members, and it's actually going to help politically, because when we enroll the pensioners, when we had a discussion with the governor, and he gave us the idea to enroll the pensioners, initially we thought there were 18,000 from the first record we got. But later we found out that there are two groups, the contributory pensioner and the non-contributory pensioner. And pensioners are pensioners, so we have to bring all of them on board. When we got them on board, they were 23,000. But we still have to go on to register all of them. But that's not actually the figure. Because what we discover now is that every day people retire. And as they retire, they run to OIS. And it's a continuous process. I've discussed this with the government that where it's not 23,000, that is going to be a continuous process. As people retire, we'll bring them on board. And when we did that, it really gave the government a very wide popularity everywhere in the country. In fact, I tell you today that 7 states have followed suit, including Oyo State, that is our labor head. And they have also started modalities of registering the pensioners in their state. In fact, 3 states have sent their representative to us in Osun State to come and understudy how we did our own, and it's working. And it's not political anything. It is with sincerity that we are doing that. Now the pension, we have started the treatment. February 1st, they have started going to hospitals to receive treatment. And they are not paying 10%. You know, the normal thing is that under the insurance policy, they go to hospital, they pay 10% of the drug. So if the drug is 10,000, you pay 1,000. If it's 1,000, you pay 100 naira. But for the pensioners, they are not paying anything. And that's what we have done. And we're not, and it covers anything that they take into as far as our scope is concerned. We have also had plans of also bringing support to the people. The law for the health insurance says that it's mandatory for all inhabitants in any state to be part of the insurance system. Toto should be one living family, it's difficult to enforce such law if the economy is still bad. So that's why we cannot enforce it. But on our own part, we also presently we are registering the people living with HIV. The Ministry of Health has contacted us, and I said that the policy for the HIV people, that if we can bring them in, they can use that as a means of negotiating for something better for the people living here. So we have started the registration, and I think by now we have registered about 400 people living with HIV, free of charge, the way we have registered the pensioners. Also, recently we have, from behalf of the government, engaged people with disabilities, and there are about 4-5 categories of these people. We still had a meeting with their representative 2 days ago at the agency. The people who are physically challenged, those who don't, who have polio problem with mobility and things like that, they are pillows in their feet, those who have spinal cord injury, maybe from accidents or anything, they are also there, and then the blind and the deaf. All these people have different challenges, and interacting with them gave us a lot of insight into some of their problems. For instance, we had that one patient who was deaf and dumb died while giving birth at home. And when we investigated, I mean, it was so pathetic that the person actually went to the hospital, but nobody understood what she was saying. The husband was also deaf and dumb. The doctor didn't understand. The nurses didn't understand. So in frustration, they left the hospital. And they were only left at the mercy of neighbors who could not help when the woman was giving and actually bled to death following the childbirth. So we are intending to engage the training of health workers in interpretation, sign language. I just discussed that with the government recently, that we may have to engage nurses from government hospitals to train them about sign language, so that when these people come, they will be the one that will be interpreting.
Representative for Ife Central State Constituency in Osun Parliament commended the leadership and members of staff of Osun Health Insurance Agency for their commitment to the effective delivery of the mandate of the provision of easy access for the residents in Osun State to quality and affordable healthcare services. Expressing readiness of the present assembly to give maximum support to Osun Health Insurance Scheme at ensuring the full realization of the mandate of the universal coverage of all residents in the state.
Giving us DC and AC powered fan. I want to say thank you so much. What OEC is doing in Osun is very, very important, because as we all know, health is wealth. The other day, the World Health Organization, they came to the Osun House of Assembly, and they were so impressed in the way our honorables there engaged them on their mission to the Osun House of Assembly. So I want to say thank you. And the other day, we met at Mr. Deputy Governor's office, and I promised, in fact, I am ready to make good my promise. The money is on ground already. So I'll be starting my consensus with 100 people. I have decided that it will be aged people and disabled people. Whichever way, I'm still looking at how I'm going to share the formula, because we have to make sure that we support OEs. When the WHO came, I told them that I made my research and I discovered that our health insurance scheme in Osun is the best nationwide. I'm not trying to put you on a big horse and sell you to Israel, but I'm saying this because of my research, because I discovered that you can enjoy it throughout the nation, and the premium is very commendably small. And Mr. Governor has already enrolled pensioners, and like you said, my own mother is a civil servant. She'll be retiring in December, and you have to be rest assured that I'm going to bring her to enjoy this scheme as well, because it is a wonderful one.
Representative for Obokun State Constituency, Honorable Adeyemi Adewumi, who also gave kudos to Osun Health Insurance Agency for the successful delivery of its mandate, advised the agency to take the advocacy to different associations in the state.
Some more data that you talk about, and it's impressive. At least you have a very good vision, to expand the number of people that will be benefiting from this scheme. That's a very good one. And even though you've not gotten to your target yet, at least you've moved. I think about, if my maths is right, more than 100% of what you meant of ground, and that is fantastic. And that if we can continue like this, we will meet that target. You can even surpass it. So OIS is a very wonderful scheme, just like my honorable colleague have just said, a fantastic scheme. And maybe we should even start from the honorable members, if anyone of them are not even enrolled in the scheme, to also be a part of it. So it's a very good one. So I want to sincerely commend you. And if we're having a 5.5 million population, and we are having barely about 4,000 with what you met on ground, and you've been able to increase it to about 13,000, that is fantastic. So your target is to have 3 million in the scheme, and that's a good one. And you've successfully, you told us the steps you have been taking to make sure you reach that target of 3 million. You've met the local government. Now you are at the House of Assembly. Maybe I should just briefly speak on that. In my own opinion, with your permission, I think it's not a bad idea. One way or the other, it even be a way. Thank God for the life of honorable member of Community Central. It will be a way to even expand the frontiers of our campaign. Campaign promises. I just did a calculation now because I'm aware it's just about 12,000 thereabouts. So I did a rough calculation of about it's just less than 1.3 million, and especially our honorable colleague from the South is a big man. As you can see from it. So my point to that is that it's something that we can, and it's a yearly thing, right, sir? So I would just want to, me personally, I'm in full support of this, and I will enjoy my honorable for this to also try and support. And if that is 100, that's about 2,600.
Honorable Taufik Olalekan Olayiwola, who is the mouthpiece of Ede South State Constituency in Osun State House of Assembly, made this suggestion to Osun Health Insurance Agency.
So this idea of members registering people from their constituency, which I so much fought for. But I have a question. What about the one that Afugura was? Wait. Thank God we are from the same constituency. You know Ajoba, you know Idiagbo, you know Alajue, and you know Logo. Why do we do that?
We will go there, sir. We will go to those places to register them. It's just for whoever is the traditional head here to announce. We will take our machines there, we will register them.
I'm not complaining about this. How do they access facilities?
Oh, it is in us. Well, I wouldn't know. We would because occasionally we have that problem, sir. That some areas don't have hospitals that are accredited with us. We are trying our best to get hospitals in every part of the state registered with OIS. So we have to be careful too, so that we don't bring substandard hospitals that will now be giving substandard care to people.
Responding, Speaker Osun State House of Assembly, Right Honourable Adewale Olumide Egbedun, commended Osun Health Insurance Agency for the great achievements being made by the agency at ensuring the easy access of the residents in the state to quality health care without tears. He also commended Governor Ademola Jackson-Nudin Adeleke for his dedication to revitalizing healthcare delivery system in the state.
Revitalizing healthcare in Osun State, evident in the enrollment of over 23,000 pensioners homes. Under the leadership of the 8th Osun State House of Assembly, we will continue to support transformative policies and actions that benefit our people, ensuring that Osun State reclaims its forefront position in Nigeria. Once again, I warmly welcome you and look forward to our ongoing collaboration in advancing healthcare for the betterment of our great state. Thank you for calling, and let me use this opportunity to express my appreciation for the gift, and I want to assure you that the 8th Osun State House of Assembly, we are willing, though we are going to have a robust deliberation about this, we are going to come up with our own ideas. We invite you to have a robust deliberation to achieve same goal. But I think this is a beautiful initiative, and we are willing to partner with you. Thank you so much for the gift. Especially the years. Thank you for always being there. It has always been supportive. And thank you for everything. Thank you for raising Osun State flag every time. Thank you, and God bless you.
With the unflinching support being received by Osun Health Insurance Scheme from Governor Ademola Jackson-Nudin Adeleke and the maximum support of the 8th Osun Parliament, Osun Health Insurance Agency is sure to retain its leading position among the Committee of States Health Insurance Agencies in Nigeria. Ẹ káàbọ̀ sábàlá ètò ìlédè abínibí wa ń ta sọ̀rọ̀ lé lórí lónìí ní àbẹ̀wò àtìlẹ́yìn tí àjọ ìtòfò ìlera ìpínlẹ̀ Ọ̀ṣun tí akọ̀wé àgbà dókítà Rasaki Akíntúndé Akíndélé Kúsòdí lọ ṣe sí ilé ìgbìmọ̀ aṣòfin ìpínlẹ̀ Ọ̀ṣun. Bó ti ṣe jẹ́ wípé ó jẹ́ ẹ̀tọ́ gbogbo olùgbé ìlú láti ní àǹfààní sí àlàáfíà tó péye pẹ̀lú owó péréte láláì fi tipò tẹ́nìyàn wà láwùjọ ṣe. Èyí gan-an ló ṣe atọ́kùn fún ìdásílẹ̀ àjọ ìtòfò ìlera ìpínlẹ̀ Ọ̀ṣun. Látàrí bó ṣe jẹ́ wípé ìmọ̀ tí àwọn adarí àti òṣìṣẹ́ iléeṣẹ́ àjọ ìtòfò ìlera ìpínlẹ̀ Ọ̀ṣun ní lórí erédìí ìdásílẹ̀ àjọ náà ló ṣokùnfà bí wọ́n ti ṣe ní ìfijìn sí ìmúṣẹ tófin tó ṣàgbékalẹ̀ àjọ náà lọ́wọ́ ní rírí dájú wípé gbogbo olùgbé ìpínlẹ̀ Ọ̀ṣun ló ní àǹfààní sí ètò ìlera tó péye pẹ̀lú owó ìdákọ̀mu. Pẹ̀lú àtìlẹ́yìn gbọ̀ngbọ̀n tí ìjọba gómìnà Adémọ́lá Jackson-Nudin Adeleke ń darí rẹ̀ ń ṣe fún àjọ ìtòfò ìlera ìpínlẹ̀ Ọ̀ṣun nípa ìmúṣẹ ìlérí rẹ̀ mímú ìmúgbòòrò bá ètò ìdójútòfò ìlera ní ìpínlẹ̀ Ọ̀ṣun. Èyí gan-an ló fún àwọn olùdarí àjọ náà tí akọ̀wé àgbà àjọ ìtòfò ìlera ìpínlẹ̀ Ọ̀ṣun dókítà Rasaki Akíntúndé Kúsòdí ní ìgboyà láti lọ kàn sí ilé ìgbìmọ̀ aṣòfin ìpínlẹ̀ Ọ̀ṣun láti lọ bèrè àtìlẹ́yìn lé níbi tí abẹnugan ilé ọ̀nàrẹ́bù Adéwálé Olúmídé Ẹgbẹ́dùn àti àwọn ọmọ ilé ti gba àwọn adarí ẹ̀ka láti àjọ ìtòfò ìlera náà lálejò látòrí akọ̀wé àgbà dókítà Rasaki Akíntúndé Akíndélé, igbákejì akọ̀wé àgbà ẹni tó tún jẹ́ olùdarí ẹ̀ka tó ń bójútó ètò gbogbo apòògùn òyìnbó Ọlásùnkànmí Sùmọ́nù, adarí ẹ̀ka tó wà fún ìtọpinpin ìwádìí àti ìṣirò dókítà Ràúfù Ọlálérè Adébísí, adarí ẹ̀ka tó wà fún ìlànà à ń tẹ̀lé àti iṣẹ́ tó yanrantí dókítà Ṣínà Ìgbàláyé, adarí ẹ̀ka tó wà fún ìgbanisíṣẹ́ àti onírúurú iṣẹ́ gbogbo ìyáàfin Fúnmi Jerry Adétòrò, adarí ẹ̀ka tó wà fún ìṣúná owó ìyáàfin Ọlábísí Ọlájùbú àti olùṣàkóso ẹ̀ka tó ní ṣe pẹ̀lú ìròyìn àti ìmọ̀ ọ̀gbẹ́ni Ṣẹ́gun Ọ̀dẹ́wùmí. Abẹnugan ilé ìgbìmọ̀ aṣòfin ìpínlẹ̀ Ọ̀ṣun tó kan sáárá sí àjọ ìtòfò ìlera ìpínlẹ̀ Ọ̀ṣun fún iṣẹ́ ribiribi tájọ náà ń ṣe láti rí i dájú pé àwọn olùgbé ìpínlẹ̀ Ọ̀ṣun ní àǹfààní sí ètò ìlera tó péye pẹ̀lú owó péréte tún gbóríyìn ràbàtà fún gómìnà Adémọ́lá Jackson Nurudeen Adeleke fún àtìlẹ́yìn gbọ̀ngbọ̀n tó ń ṣe fún àjọ náà láti lè mú kó rọrùn fún àjọ náà láti lè ṣe onírúurú àṣeyọrí rere tó ń ṣe.
Àwọn àjọ OIS, especially Dr. Akindele, for this beautiful initiative. Wọ́n wá pẹ̀lú proposal tó dáa, and we at the House of Assembly are willing to support them.
Aṣojú ẹ̀ka ìdìbò àárín-gbùngbùn Ilé-Ifẹ̀ nílé ìgbìmọ̀ aṣòfin ìpínlẹ̀ Ọ̀ṣun Honorable Abiola Jeremiah Awoyeye náà gbóríyìn fún àjọ tó fòyera ìpínlẹ̀ Ọ̀ṣun àti gómìnà Adémọ́lá Adeleke ó sì tún jẹ́jẹ́ àtìlẹ́yìn rẹ̀ gbọ̀ngbọ̀n fún àjọ náà.
Gómìnà olóríire wa His Excellency Senator Nurudeen Jackson Adémọ́lá Adeleke wọ́n tì wọ́n lẹ́yìn dáadáa. Àwa ní House of Assembly bí náà a ready láti tì wọ́n lẹ́yìn. Èmi gẹ́gẹ́ bí ẹnìkan Honorable Abiola Jeremiah Awoyeye láti ìjọba ìbílẹ̀ àárín-gbùngbùn Ifẹ̀ mo ti ṣetán lágbára Ọlọ́run.
Akọ̀wé àgbà fún àjẹtòfò ìlera ìpínlẹ̀ Ọ̀ṣun Dókítà Rasaki Akindele ṣàlàyé lẹ́kùnrẹ́rẹ́ èrèdí àbẹ̀wò àwọn adarí ẹ̀ka àjẹtòfò ìlera ìpínlẹ̀ Ọ̀ṣun sílé ìgbìmọ̀ aṣòfin ìpínlẹ̀ Ọ̀ṣun.
Mo ní a wá sí ilé ìgbìmọ̀ aṣòfin láti wá darapọ̀ mọ́ láti bá wọn sọ̀rọ̀ lórí pé in tó dáa ni kí wọ́n mú àwọn èèyàn wa ní gbogbo constituency wọn wọ́n fi wọ́n sínú program tá à ń ṣe OIS Health Insurance Scheme. Ìyẹn á jẹ́ kí ìlera àwọn èèyàn kó tún ṣe déédéé sí kò ṣègbà tí èèyàn bá dé kó sick kò rówó lọ sí hospital tó wá jẹ́ pé nǹkan tí ò yẹ kó ṣe èèyàn ní jàǹbá tó wá ṣe ní jàǹbá tí wọ́n bá forúkọ wọn sílẹ̀ ẹ̀dì kan 12,066 naira fún odidi ọdún kan gbogbo tó bá ṣe yóò lọ sí hospital láì ṣe pé bóyá ó wà lápò ẹ̀ tàbí òṣòwò lápò ìdí tá a fi wá bá wọn tá a fi wá bẹ̀ wọ́n nìyẹn pé kí wọ́n ṣíjú àánú wo aráàlú kàn ṣe lára àwọn constituency project wọn pé nǹkan tó fẹ́ ṣe ni inú wa sì dùn pẹ̀lú pé àwọn gbà wá tọwọ́ tẹsẹ̀.
Pẹ̀lú àtìlẹ́yìn gbọ̀ngbọ̀n tí ìjọba tí gómìnà Adémọ́lá Jackson Nurudeen Adeleke ń darí pẹ̀lú ìfọwọ́sowọ́pọ̀ ilé ìgbìmọ̀ aṣòfin tí abẹnugan Honorable Adéwálé Olúmídé Ẹgbẹ́dùn darí ṣe fún àjẹtòfò ìlera ìpínlẹ̀ Ọ̀ṣun ó dájú pé àjọ náà kò lè kúrò nípò aṣíwájú tó wà láàrin àwọn akọgbẹ́ rẹ̀ káàkiri àwọn ìjọba ìpínlẹ̀ lórílẹ̀‐èdè Nàìjíríà. Ǹjẹ́ ibi tí a ó ti máa dáhùn dúró lónìí lórí ètò ẹ jẹ́ ká ó sì jọ pàdé lọ́sẹ̀ tó ń bọ̀ fún àkọ́tún ètò yìí kan náà láṣẹ Olódùmarè ọba àṣẹ̀dá ǹjẹ́ tí ìgbà náà eré o.